Have you ever woken up in the middle of the night once again with that urgent need to go to the bathroom? Or maybe you're tired of feeling like your bladder never completely empties? My friend, if you're over 60, you probably know exactly what I'm talking about. Prostate health is something most men prefer not to discuss, but today I'm going to reveal information that can literally transform your quality of life. What you'll discover in the next few minutes isn't just generic advice. These are proven strategies that can significantly reduce discomfort and prevent more serious prostate-related problems. And the most surprising part, many of the habits that harm your prostate health are part of your daily routine without you even realizing it. Stay until the end, because in the last topic I'll share a controversial but scientifically proven practice that can dramatically improve your prostate health. Before we continue, click the subscribe button and turn on notifications. I promise that every video on this channel will bring valuable information you won't find in traditional medical offices. Let's go. Harmful habits for the prostate. The prostate, that small walnut-sized gland, can become the biggest source of discomfort in a man's life after 60. The problem is that many of us daily feed habits that silently harm its health, without having the slightest idea of the damage we're causing. Think about sedentary lifestyle, for example. Those hours sitting watching television aren't just bad for your waistline, but create a perfect environment for inflammation in the pelvic region that directly affects your prostate. Poor diet is another villain we can't ignore when talking about prostate health. That Sunday barbecue full of fatty meats, accompanied by beer and finished with sugary desserts, it's a perfect storm for your prostate. These foods promote chronic inflammation in the body, and the prostate, unfortunately, is one of the first to feel the effects. A third devastating habit is insufficient hydration. Many men avoid drinking water to prevent frequent bathroom trips, without realizing they're only making the problem worse. Completing our list of hidden prostate enemies are smoking, chronic stress, lack of restorative sleep, and the absence of regular checkups. Cigarettes, besides all the already known problems, impair blood circulation, which is essential for pelvic region health. Stress releases hormones that contribute to inflammation throughout the body, including the prostate. Poor sleep affects your immune system, making you more vulnerable to problems. And finally, postponing medical appointments out of fear or embarrassment can transform a treatable problem into something much more serious. But don't worry, in the next few minutes, I'll show you how to reverse these harmful habits. Habit 1. Importance of adequate hydration. Did you know your prostate sends distress signals every time you go hours without drinking water? Adequate hydration is one of the most fundamental and frequently ignored pillars when we talk about prostate health. When you don't consume enough water, your urine becomes concentrated, irritating not only the bladder, but also the urethra and consequently the prostate that surrounds it. An adult man would ideally need to consume between 2.5 to 3 liters of water daily, but most don't come close to this, preferring to substitute water with beverages that actually worsen the situation. Coffee, alcohol, and sodas, the trio that many men consume daily, are diuretics that increase urine production without properly hydrating the body. Coffee, although it has its benefits, when consumed in excess, irritates the bladder and can increase urinary urgency, a common symptom in men with prostate problems. Alcohol not only dehydrates, but can also negatively influence hormones related to the prostate. Sodas combine sugar, inflammation, and caffeine, irritation, a disastrous combination for those who already suffer from urinary problems. The solution is simple but requires discipline. Make water your main beverage throughout the day. A practical tip is to start your morning with a large glass of water and keep a bottle always in sight during the day. Another effective strategy is to establish fixed times for hydration, such as drinking a glass before each meal and another 2 hours after. Don't worry about the initial increase in bathroom trips. Over time, your bladder adapts to a larger volume of liquids, and the benefits for your prostate will be notable. Less inflammation, better urinary flow, and significant reduction in symptoms of benign prostatic hyperplasia, a condition that affects about 50% of men over 60. Habit 2. Anti-inflammatory diet. What you put on your plate has a direct and powerful impact on your prostate. This is a truth that modern medicine is finally recognizing. Chronic inflammation is one of the main factors contributing to prostate problems, and your diet can be both the cause and the cure. Diets rich in saturated fats, processed red meats, refined sugars, and ultra-processed foods create an inflammatory environment throughout the body, and the prostate, due to its characteristics, ends up being particularly vulnerable to these negative effects. Each time you opt for fast food or that industrialized sweet, you're essentially feeding the inflammation that may be silently affecting your prostate gland. In contrast, a diet rich in fruits, especially red and purple ones like blueberries, strawberries, and pomegranates, offers powerful antioxidant protection to the prostate. Cruciferous vegetables, broccoli, cauliflower, cabbage, contain compounds that help balance hormones and reduce the risk of abnormal prostate growth. Cold water fish like salmon, sardines, and tuna are rich in omega-3, a natural anti-inflammatory that directly benefits prostate health. Completing this nutritional arsenal, whole grains, nuts, and seeds provide fibers, vitamins, and essential minerals that promote general health and consequently the proper functioning of the prostate. The transition to a more prostate-friendly diet doesn't need to be radical or painful. Start by replacing one item at a time. Swap red meat for fish twice a week. Add an extra portion of vegetables to your main meals. Choose fruits as dessert instead of industrialized sweets. A valuable tip is to incorporate anti-inflammatory teas into your routine, such as green tea or pomegranate peel tea, which recent studies associate with improved urinary symptoms in men with prostatic hyperplasia. Remember, each bite is an opportunity to nourish your prostate or overload it, and this choice, made meal after meal, can determine how you'll live your golden years. Habit 3. Physical exercise as a pillar of prostate health. A sedentary lifestyle is one of the biggest enemies of your prostate, and unfortunately, also one of the most common habits among men over 60. When you spend hours sitting, blood flow to the pelvic region drastically decreases, creating an environment conducive to prostatic congestion and inflammation. It's as if your prostate became stagnant, without the necessary circulation to eliminate toxins and inflammatory cells. Recent studies show that men who practice regular physical activity have up to 25% less chance of developing serious prostate problems compared to sedentary ones, a number we can't ignore when talking about quality of life in the senior years. Physical exercise acts on multiple fronts to protect your prostate. It improves blood circulation in the pelvic region, significantly reduces inflammatory markers throughout the body, helps with weight control, a factor directly related to prostate problems, and balances hormone levels. Daily 30-minute walks, for example, are already enough to awaken these benefits. Specific exercises like squats, bridge, and Kegel strengthen the pelvic floor muscles, giving additional support to the prostate and improving urinary control, an extra benefit particularly valued by those already facing symptoms of benign prostatic hyperplasia. The good news is that it's never too late to start moving and reap the benefits for your prostate health. Start slowly, respecting your limitations, and gradually increase the intensity and duration of exercises. Low-impact activities such as swimming, water aerobics, and cycling are excellent options for beginners and offer significant benefits with lower risk of injuries. An effective strategy is to associate exercise with some pleasurable activity, such as walking with friends, dancing with your partner, or practicing Tai Chi in a park. This way, you ensure not only your prostate health, but also benefits for your mental and emotional well-being. Remember, each step taken is a victory against the inflammation that threatens your prostate. Habit 4. Harmful effects of alcohol. That beer at the end of the day or wine at dinner may seem harmless, but when we talk about prostate health, alcohol deserves a much more attentive and cautious look. What few men know is that regular consumption of alcoholic beverages can raise estrogen levels in the male body, creating a hormonal imbalance that favors abnormal prostate growth. This is one of the mechanisms by which alcohol directly contributes to the aggravation of benign prostatic hyperplasia, BPH, a condition that affects most men over 60 and causes those uncomfortable urinary symptoms that steal nights of sleep and quality of life. Beyond the hormonal impact, alcohol acts as a direct irritant to the prostate and urinary tract. It's a potent diuretic, increasing urine production and, consequently, the frequency of bathroom trips. precisely one of the symptoms that most bother those who already suffer from prostate problems. To make matters worse, alcohol also dehydrates the body, making urine more concentrated and therefore more irritating to the bladder and urethra. A recent study followed men with moderate prostate symptoms and found that those who reduced their alcohol consumption by half experienced an improvement of approximately 30% in urinary symptoms in just 3 months. An impressive result for a relatively simple change. If you're not ready to completely abandon alcohol, consider at least a significant reduction and some intelligent consumption strategies. Limit yourself to at most 1 standard drink per day, a can of beer, a glass of wine, or a shot of spirits, always accompanied by a glass of water to minimize dehydration. Establish at least 3 alcohol-free days per week, giving your prostate time to recover from irritation. Observe carefully how your body responds. Many men notice a direct correlation between nights of higher consumption and worsening of prostate symptoms the following morning. This awareness may be the incentive you needed to finally prioritize your prostate health above that momentary pleasure of alcoholic beverages. Habit 5. Essential nutrients like vitamin D, B complex, and zinc. Your prostate hungers for specific nutrients, and satisfying these needs can be the difference between a healthy gland and a problematic one. Vitamin D, often called the sunshine vitamin, plays a crucial role in prostate health that most doctors rarely mention. Recent studies reveal that men with adequate vitamin D levels have a lower incidence of serious prostate problems and better response to treatments. The surprising part is that more than 70% of men over 60 show deficiency in this vital vitamin. 15 minutes of daily sun exposure, preferably in early morning or late afternoon, already offers a significant dose. Alternatively, include fatty fish like salmon and sardines in your diet, or talk to your doctor about proper supplementation. The B complex, especially vitamins B6, B9, folic acid, and B12, forms another essential pillar for prostate health. These vitamins act by regulating hormonal metabolism and reducing homocysteine, an amino acid that at elevated levels is associated with chronic inflammation, the #1 enemy of the prostate. Dark green leaves like spinach and kale, whole grains, legumes, and lean meats are excellent sources of these nutrients. A particularly interesting aspect is that B-complex vitamins work in synergy with other prostate protective nutrients, enhancing their effects. A colorful and varied plate, including at least 5 different colors of natural foods per day, is a simple and effective strategy to ensure an adequate supply of this vital complex. Zinc completes this trio of essential nutrients for your prostate, perhaps being the most crucial of them. The prostate concentrates more zinc than any other organ in the male body, using it for fundamental hormonal and immunological functions. Deficiency of this mineral is consistently associated with increased risk of prostatic hyperplasia and other problems. Lean meats, oysters, pumpkin seeds, Brazil nuts, and legumes such as chickpeas and lentils are excellent sources. A practical tip: add a handful of pumpkin seeds to your morning yogurt or lunch salad. This simple measure can provide up to 40% of your daily zinc need. Remember that balance is fundamental. Both the lack and excess of these nutrients can be harmful, so ideally, do periodic exams to check your levels and adjust your diet as needed. Habit 6. Stress management. Chronic stress is like a silent poison for your prostate, but very few men make this crucial connection. When you live constantly under pressure, your body releases a cascade of stress hormones, mainly cortisol and adrenaline, which originally evolved to protect us in situations of immediate danger. The problem is that in modern life, this system remains permanently activated, creating a chronic inflammatory state throughout the body. The prostate, with its rich network of nerve endings and high hormonal sensitivity, becomes particularly vulnerable to this inflammatory environment, reacting with swelling, discomfort, and aggravation of existing urinary symptoms. Beyond the direct impact via inflammation, stress harms your prostate through equally devastating indirect routes. It compromises sleep quality, essential for cell regeneration and hormonal regulation. Stressed men tend to make worse dietary choices, consume more alcohol and caffeine, and neglect physical activity, all behaviors that, as we've seen, are harmful to prostate health. Another frequently ignored mechanism is the impact of stress on the immune system. When chronically stressed, your immunity weakens, leaving the prostate more susceptible to infections and inflammatory processes that can evolve into more serious conditions if not properly treated. Fortunately, there are proven strategies to reduce stress and protect your prostate, starting with simple, deep breathing techniques that can be practiced anywhere. Just 3 minutes of conscious breathing 3 times a day have already demonstrated significant reduction in cortisol levels. Meditation, even if for only 10 minutes daily, has proven effective not only in reducing stress, but also in decreasing specific inflammatory markers associated with prostate problems. Activities such as Tai Chi, yoga, and walks in nature combine the benefits of physical exercise with mental relaxation. Don't underestimate the power of positive social connections either. Men with strong social bonds have lower rates of prostate problems, possibly because social support functions as a powerful natural antidote to the chronic stress that so harms your prostate. Habit 7. Masturbation as a beneficial practice. We've arrived at the topic I promised at the beginning. Controversial, rarely discussed in medical offices, but with strong scientific support. Regular masturbation can be one of the most beneficial practices for your prostate health. Contrary to old myths that associated frequent sexual activity with prostate problems, modern science demonstrates exactly the opposite. Regular ejaculation, whether through sexual intercourse or masturbation, helps empty the prostatic ducts, eliminating secretions that, if retained for long periods, can become irritating to prostate tissue and potentially contribute to chronic inflammations. A study published in the respected Journal of the American Medical Association followed more than 30,000 men for 18 years and concluded that those with higher ejaculatory frequency, 21 times or more per month, showed a 33% reduction in the risk of developing serious prostate problems compared to those who ejaculated less frequently. The benefits of regular ejaculation go beyond the simple cleaning of prostatic ducts. During orgasm, a vigorous contraction of the pelvic region muscles occurs, providing a kind of natural massage to the prostate. This massage improves local blood circulation, essential for tissue health, and helps reduce the congestion and swelling characteristic of benign prostatic hyperplasia. Many men with urinary symptoms report significant temporary improvement after ejaculation. Urinary flow becomes stronger, the sensation of incomplete bladder emptying decreases, and urinary urgency and frequency reduce for a few hours or even days. These anecdotal reports now find support in studies that demonstrate that ejaculation stimulates the release of anti-inflammatory substances that directly benefit prostate tissue. It's important to demystify this topic, especially for older men who may have grown up in times when masturbation was considered taboo or even harmful. Regular masturbation at any age is a natural, healthy, and potentially therapeutic practice for the prostate. For men without active sexual partners, it represents an accessible way to maintain the benefits of regular ejaculation for prostate health. Beyond the direct physical benefits, sexual activity, including masturbation, promotes the release of endorphins and other neurotransmitters associated with well-being, stress reduction, and improved sleep, all factors that indirectly contribute to prostate health. As with everything in life, balance is fundamental. Both prolonged abstinence and excess can cause discomfort for some men, so find the frequency that works best for you and your body. We've reached the end of this journey through prostate health, but in reality, for you, this is just the beginning of a new phase. Imagine waking up without that constant urgency to go to the bathroom, sleeping through the night without interruptions, and resuming activities you had abandoned due to prostate discomfort. All this is possible when you implement the habits I shared today. The question I leave you with is, what will you do differently starting tomorrow? Will it be increasing your hydration, including more anti-inflammatory foods in your diet, starting a light exercise routine, or maybe giving more attention to your sexual health? Whatever your choice, remember that small, consistent changes have a much greater impact than big transformations that last only a few days. If this content was valuable to you, help other men access this information. Subscribe to the channel, activate notifications, and share this video with friends and family who could benefit. Men's health is still a topic surrounded by taboos, and together we can change this. In the next video, I'll talk about essential exams every man over 50 should have annually. Information that can literally save lives. Until then, take care, because you deserve a full and comfortable life, regardless of age.